Hello friends, now we will discuss about the mediators of inflammation. Inflammatory mediators are the substances that initiate and regulate the inflammatory reactions. They can be vasoactive amines, lipid products, cytokines, chemokines, complement products. Inflammatory mediators are mainly of two types: cell derived or plasma derived. In cell derived we have histamine, prostaglandins, leukotriens, cytokines, and in plasma derived we have complement proteins and kinins. Active mediators are produced only in response to an offending stimuli, which can be microbial product or necrotic cells. Most of the mediators are short-lived. They vanish after their purpose served. One mediator can stimulate the release of other mediator. Products of complement activation. For example, products of complement activation stimulate the release of histamine and TNF cytokines. Some of the abbreviation we are going to use in this lecture: VC for vasoconstriction, VD for vasodilation, VP for vascular permeability. Now we will see various inflammatory mediators on the basis of their source of production and their action. Histamine is a vasoactive amine which is produced by mast cell, basophil and platelet, and act as a vasodilator, increase vascular permeability, and plays an important role in endothelial activation. Other inflammatory mediator is serotonin, also known as 5-hydroxytryptamine, produced by platelets and neuroendocrine cells of the GIT. Act as a vasoconstrictor or a neurotransmitter. Another class of inflammatory mediators are prostaglandins. Source of production is mast cell, leukocytes. Act as a vasodilator, plays an important role in pain and fever. Leukotriens, produced by mast cell and leukocytes, act as a increase vascular permeability, plays an important role in chemotaxis, leukocyte adhesion and activation. Cytokines, for example, tumor necrosis factor alpha, interleukin 1, interleukin 6, they produced by macrophages, endothelial cells and mast cell. They act locally as an endothelial cell activation, in which endothelial cell express the various adhesion molecule, and in systemic action they are responsible for the development of fever, metabolic abnormalities, and have a role in hypotension. Chemokines, produced by leukocytes, activated macrophages, have an important role in chemotaxis, leukocyte activation. Platelet activating factors, produced by leukocyte and mast cells. Their action is vasodilation and increased vascular permeability, responsible for leukocyte adhesion, chemotaxis and degranulation. Complement products, they produce in liver and mainly they are plasma derived. responsible for vasodilation, chemotaxis, leukocyte activation, direct target killing. Kinins produced in liver. They are also a class of plasma derived inflammatory mediators responsible for increased vascular permeability, vasodilation, important in the pain and smooth muscle contraction. Now we will discuss about the one of the important class of inflammatory mediators known as arachidonic acid metabolites. Whenever there is mechanical, chemical and physical stimuli or some other mediators like C5a of complement, they are responsible for the production of arachidonic acid from the membrane phospholipid. Arachidonic acid is also known as icosanoid, a 20 carbon acid. It is derived from linoleic acid. So as we have discussed, arachidonic acid derived from the cell membrane phospholipid. Phospholipases act on this linoleic acid or membrane phospholipid, and there will be a production of arachidonic acid. Arachidonic acid, by the action of cyclooxygenase enzyme, converted into the prostaglandin G2, which further converted into prostaglandin H2, then prostaglandin I2, thromboxane A2, and prostaglandin D2 and E2. Prostaglandin I2, also known as prostacyclin, which acts as a vasodilator and inhibit platelet aggregation. On the other hand, thromboxane A2 act as a vasoconstrictor and stimulate platelet aggregation. Prostaglandin D2 and E2 are vasodilator and plays an important role in increased vascular permeability and act as a chemotactic agent, PGD2. On the other hand, arachidonic acid, by the action of 5-lipoxygenase, converted into 5-hydroperoxy icosatetraenoic acid. HPETE stand for hydroperoxy icosatetraenoic acid, and HETE stand for hydroxy icosatetraenoic acid. So this 5-hydroperoxy icosatetraenoic acid converted into 5-HETE, which is a chemotactic agent, and 5-HPETE converted into leukotriene A4, which is further converted into leukotriene B4, which also acts as a chemotactic agent. Leukotriene A4 converted into C4, leukotriene D4 and leukotriene E4. They act as a they act as increasing vascular permeability and causes bronchospasm. On the other hand, 5-HPETE, by the action of 12-lipoxygenase, converted into lipoxin A4 and lipoxin B4. They inhibit neutrophil adhesion and inhibit chemotaxis. So these are the arachidonic acid metabolite. By the action of cyclooxygenase, prostaglandin produced, and by the action of 5-lipoxygenase, leukotrienes produced. Icosanoids bind to G protein coupled receptor and mediate virtually every step of the inflammation. Now we will briefly see the various action of the icosanoids. Vasodilation caused by prostaglandin I2, E1, E2 and D2. vasoconstriction, thromboxane A2, leukotriene C4, D4, E4, increase vascular permeability, leukotriene C4, D4, E4, chemotaxis, leukotriene B4, and hydroxyicosatetraenoic acid. Cytokines, chemokines, and complement we will discuss in the separate lecture. In this lecture we will discuss some remaining inflammatory mediators. Other mediators of inflammation: platelet activating factors. They derive from the phospholipid and released by platelet, neutrophil, mast cell, endothelial cell, macrophages, and basophils. They act by vasoconstriction and also responsible for bronchoconstriction and responsible for the platelet aggregation. Coagulation products: protease activated receptor got activated by thrombin. They are present on the leukocytes. Kinins: they are vasoactive peptides. The precursor is kininosin, which is high molecular weight kinins, with the help of kallikrein converted into the bradykinin, which is short-lived and inactivated by the kininase. Bradykinin act by increasing vascular permeability, responsible for vasodilation and contraction of the smooth muscle, and plays an important role in pain. Another type of inflammatory mediators are neuropeptides. They are secreted by the sensory nerve and leukocytes. For example, substance P and neurokinin A, they produced in CNS and PNS. Also, substance P produced by lung and GIT. They act as or play a role in pain signal. They are also responsible for increased vascular permeability. They basically play an important role in crosstalk between nervous system, immune system, and inflammatory reaction. For example, in vagus stimulation, whenever vagus is stimulated, it inhibits the pro-inflammatory cytokines like tumor necrosis factor by involvement of these neuropeptides. Now we will see the reaction of inflammation and the various mediators responsible for it. Vasodilation, histamine and prostaglandins, increase vascular permeability, histamine, serotonin, complement protein like C3A, C5A, leukotrienes, C4, D4 and E4. Chemotaxis, leukocyte recruitment and activation. Cytokines like TNF, interleukin 1, chemokines, C3A, C5A, leukotriene B4. Fever, cytokines like interleukin 1, TNF alpha and prostaglandin plays an important role in development of fever. Pain, prostaglandins, bradykinin and substance P responsible for the development of pain. Tissue damage, lysosomal enzymes of leukocytes and free reactive oxygen species of free radical responsible for the tissue damage. So this is the first part of inflammatory mediator. Now in the second lecture we will discuss about the cytokines, chemokines and complement protein and their role as a mediator of inflammation. Thank you.